Hi, I'm Dr. Salman Haider. I'm a consultant neurologist. My NHS practice is based at Queen Square, the National Hospital of Neurology, one of the world's leading hospitals. There I run the same-day emergency neurology care unit, and I'm bringing those skills to the private sector at Princess Grace Hospital and Queen Square private consulting rooms. Today I wanted to talk to you about TIA. TIA is commonly known as mini stroke, but it stands for transient ischemic attack, and it's, in simple terms, a warning that a stroke might be about to occur. In the first 24 hours, for example, after a TIA, that's your highest risk of having a big stroke, and that's why TIAs are really important to get assessed quickly and get seen quickly by the right people, and those are stroke doctors like myself. Now, what might be the symptoms of a TIA? TIA are called mini strokes because they can mimic the symptoms of a stroke, but they resolve usually within an hour or so. But certainly after 24 hours, there shouldn't be any symptoms, basically. So the symptoms are similar to that of a stroke, and you might be familiar with the mnemonic FAST: face, arm, speech, time. So face is drooping, speech is disturbed, arm is dropping, and it's time to call an ambulance, time to call 999. And so if that were to happen, the first piece of advice is don't call me, call an ambulance, call 999. That's the really most important thing of what I'm saying. The second most important thing to understand is once the symptoms resolve, that you need to get assessed quickly, basically. And by quickly, I mean you still should go to the ED and get seen, or you can contact a rapid access pathway and we can see you quickly. The main symptoms, as I've outlined, are face drooping, arm weakness, leg weakness, speaking disturbance, either difficulty forming words or difficulty speaking clearly, but you can also get visual disturbance, such as loss of vision or loss of one half of your visual field, so to speak. There can be other symptoms depending on the problem area in the brain. If it's at the back of the brain where the dizziness and balance centers are, you can get suddenly very dizzy, very unsteady on your feet, although there can be multiple other causes to that. You can get sudden hearing loss. There can, in fact, be weakness of both arms and both legs. And in that situation, again, I emphasize it's very important to call a 999 and get assessed quickly. And once things are stable, then you can activate a TIA type pathway. And that pathway usually involves seeing a specialist, as I said, a stroke specialist like myself, either on the NHS or privately. Most important that you're seen quickly, because remember we said that risk period is 24, 48 hours, and that you have a brain scan, an ECG, you have an MRI, you have a test to make sure the blood vessels in the neck aren't blocked that are causing the problem. They can be blocked by cholesterol plaques, for example, that you don't have an irregular heartbeat, something called atrial fibrillation. That's why we'll do an ECG for you. You have a heart scan, which is called an echocardiogram, and a more prolonged heart monitor. You'll be familiar with Fitbits and Apple Watches, but we have heart monitors professionally within the NHS that you can wear for 72 hours up to 7 days. Sits on the shoulder or on the trousers and monitors the heart rate over a period of time. And then you get some blood thinning medication and a cholesterol tablet. You get your blood pressure looked at. That all happens in a one-stop shop, which is called a TIA clinic. So the bottom line here is TIA is very important symptoms because they're harbingers or warning signs of a stroke. You need to call 999 straight away if you have anything like that, because you don't know at the time you're having the symptoms that they're going to resolve. If they do resolve, then you need, obviously, in the A&E setting or through your GP, to be referred immediately to either an NHS TIA centre or our TIA service available through Queen Square Consulting Rooms or Princess Grace. Thank you so much for your time.